everyone, I'm Anthony, and this is the Biotech Brief, where I give you short and simplified updates about the biotech industry. This brief, I'll be talking about what the blood-brain barrier is, and how one neurosurgeon recently found a way to get through it, and what that could mean for treating diseases like brain cancer and Alzheimer's. In case you're not familiar with the blood-brain barrier, it's a protective covering that surrounds the brain and keeps the brain's blood supply safe from germs and toxins that might be in other parts of the body. Even though it's easy to see the benefits of the blood-brain barrier, it's actually been somewhat of a medical obstacle for doctors, given that the barrier prevents medicines from reaching the brain in effective doses. So it's been harder to treat diseases like brain cancer, for instance, because the blood-brain barrier prevents the majority of a chemo drug from reaching the brain. That is, until now. As one recently published study shows, one neurosurgeon has figured out how to safely break the barrier in order to more effectively deliver medicine to the brain. In an ongoing clinical trial with brain cancer patients, a French doctor is using ultrasound to open the brain's barrier so that chemotherapy drugs can be delivered to patients with brain tumors. So here's how it works. First, microbubbles are injected into the bloodstream. Next, a tiny ultrasound device that has been implanted near a patient's tumor is triggered, sending sound waves through the brain, which excites the bloodstream bubbles. It's the physical pressure of the excited bubbles that temporarily pushes on cells and opens the blood-brain barrier so that chemotherapy can enter the brain. Besides sounding cool, this study is a big deal because it not only is the first study published that shows the use of ultrasound to open the blood-brain barrier, but also because it so far shows that opening and closing the blood-brain barrier repetitively can be done without harming patients. And that's a big deal because even though this technology and procedure is still in early human trials, it could help make existing brain disease treatments much more effective. It could also be a key part to treating diseases like Alzheimer's, which doctors have had few successes with treating so far. For more info on this study and technology, check out the link, and I'll see you next time.